There are nurses out there who don't give two about their patients. This story here serves as a little bit of a precursor to why I'm not working for this company anymore. Oh my God, I just remembered. This is the craziest part of the story. Now, guess what happens when she's at the hospital? You guys are not going to believe this. All right, so the story I'm going to share with you is probably, I thought about it's probably the worst, maybe the worst experience ever that I've had working as a nurse, and not necessarily because of the patient, although I do feel like the patient's a little culpable in this event, but mainly because of the patient's parents. And I've tried to record this video once before and I just kind of butchered it. So I'm just going to try to talk to you as if like you were my silent friend because I got like 12 or 15 minutes into this other video trying to record the same story, and I just get like lost in details that I can't really remember because this happened maybe a year ago. So, all right, so here's what happened. So I had this patient who I had like pretty good rapport with, right? Like we had talked a little bit before. She and I had like a pretty good conversation about computer games and all that. And we had probably talked for like a good half hour, enough to where I felt like she and I had bonded, like definitely bonded, like there was some rapport between us, right? So later in the day, she comes up to the med window and I was back there doing whatever. And she says, "Hey, Nick, could I get a lozenge?" And immediately after that, another patient comes up standing right behind her. And he says, "Yeah, I'll take a nicotine lozenge too." So then I asked her, "Okay, do you want 2 or 4 milligrams?" She tells me, kind of looks at me. She's like, I'll take, I guess, 2 milligrams. So, all right, cool. So I take out the little nicotine thing, unscrew the cap, take the lozenge out, put it in her hand. She gets 2 milligrams. She takes it, puts it in her mouth, and she goes, sits back down. Then like 15 or 20 minutes later, she comes up to me. She's like, "What did you give me earlier?" And I was like, "What do you mean?" She's like, that thing you gave me, that lozenge, what was it?" I was like, "Oh, I gave you a nicotine lozenge." And she looks at me kind of like, "Oh, that's not what I want." I was like, "Oh shit." I was like, "Well, what did you want?" She said, "I wanted a throat lozenge." And like out of all the years that I've worked as a nurse, I've never had a patient ask for a cough drop and call it a lozenge. Like they always just say, "Hey, can I get a cough drop?" And the fact that she had asked for a lozenge and then there was that patient that stood behind her, like immediately behind her and said, "I'll take a nicotine lozenge too." I'm thinking to myself before I gave her the nicotine lozenge, okay, she wants a nicotine lozenge as well. So like coupled with the fact that she didn't say cough drop and she said lozenge and there was that other patient behind her that said nicotine lozenge too, I'm thinking, okay, that's what she wanted. And then when I asked her like 2 or 4 milligrams, which were the available milligrams that we had, I thought that she must have known that like, this is a nicotine lozenge that she was getting. So anyhow, I apologized because like I don't want her to have a nicotine lozenge if she didn't want a nicotine lozenge. And then she said that her throat was feeling kind of irritated, which is like totally normal. I remember I had like a buddy that I worked with at the state hospital and like I tried one of his nicotine lozenges once and that's what it did to me. It gave me like a little bit of a headache, and I never do nicotine, right? It gave me a little bit of headache, kind of made my throat like a little tingly. And then as I had it in my gum, it sort of made it tingly as well. So I asked her, I was like, "Well, what did you do with the lozenge?" She said, "I swallowed." I said, "You swallowed the nicotine lozenge? Like even though it's causing you all those symptoms?" She's like, "Yeah." I'm like, "Okay, well, probably what's going to happen is you swallowed it, so it'll still be in your system, but like it's not going to be released as quickly. The nicotine's not going to be released as quickly as it would be if you just had it in your gum, but you'll still get a little bit of nicotine. But yeah, the symptoms will probably go away, but you might get a little bit of a stomach ache." And I think she was complaining of like a little bit of nausea, a little bit of headache, a little like heart palpitation. So I said, well, those are all pretty much normal symptoms of nicotine. Especially if you've never used it before. So I took her vitals. Her vitals were fine. I think she had like slightly elevated blood pressure. Well, now she calls her mom, or she calls her parents, and she's talking on the phone with her parents. She says, "Hey," she says, "Nick, my mom wants to talk to you. Do you mind talking to her?" I'm like, "No, not at all. As long as you got like a release of information." I checked her ROI and she's got like everything on there. I can tell her parents anything and everything that I want about her care. So I get on the phone with her mom, and her mom, like, you know, her daughter, by the way, I guess I should explain, like her daughter was very, very like flat affect, kind of like Eeyore, like poor me, but she was conversational. If you asked her questions, she'd answer them appropriately and you could have like a decent conversation with her, but very depressed, very flat mood, like very low energy, just kind of like would mope through the day, right? Well, her mom gets on the phone and her mom is like extraordinarily accusatory, like just saying all these crazy things, like the way her mom acted was like if I had given her an IV infusion of some medication that was causing her horrific side effects. Like, I kid you not, I'm not blowing this out of proportion. And very accusatory towards me. And I had to remind her mom, I was like, well, look, you know, and I told her mom everything. Like, she came up, like the story I told her about how she came up, asked for a lozenge, the patient behind her asked for a nicotine lozenge, etc. And her mom was like, but she doesn't smoke cigarettes. And I'm like, well, I didn't know that. The reality is, like, she had a nicotine lozenge that was like an active medication on her med list. Like, it was a legitimate as needed PRN medication. So I gave it to her. That's what I thought she wanted. So if anything was like a miscommunication, I don't think this would really qualify as a med error. I think it would just be a miscommunication. But anyhow, our mom is like freaking out, right? I think her mom was freaking out so bad that I just had to eventually say, like, look, I'm going to stop this conversation because I feel like you're just being very demeaning to me and I don't feel like this is productive whatsoever. And so I think I told the mom, like, if she couldn't change her tone, that we were going to end the conversation. And I think at this point what happened is that her husband, the patient's dad, was overhearing this conversation. I think they were in the same room together. So he takes over the phone call because I'm about to end the conversation. Thank God, because he was much calmer. The mom was literally hysterical on the phone, like as if her daughter was going to die. And then I remember her mom getting pissed at me because I wasn't writing down or documenting every single vital. I'm like, her vitals were within normal limits. I was like, I'm not like, and I documented the first set of vitals I took, but like every subsequent vital, I was like, I'm not going to document that. I don't necessarily need to document. Like, if a patient comes up to me and they want me to take their vitals, I'm not necessarily going to document those vitals, especially if it's done on like a routine basis. Like, sometimes I will do that because it's therapeutic for the patient. They're getting a little attention. They're getting a little TLC from staff, but I'm not going to document just a normal vital for the sake of documenting it. And her mom like would get floored that I wasn't going to do that. And, so anyhow, her husband gets on the phone and he's much calmer. And he he's like, Nick, this is my concern. And he lays out his concerns in a very formulaic manner, like very attorney-like. It was weird because I remember being on the phone with him. I was like, God, this guy strikes me like he's an attorney. Like, just the way that he would ask the questions, very formulaic and very structured. And it's like he would ask this question here, then he'd ask this question here in a very logical format, right? And so I just remember like him and I were having this conversation and it was very long and drawn out, but he was at least cordial and polite on the phone. So anyhow, they're worried because every time, according to them, every time their daughter is on the phone, she's saying that she's having like really bad chest pain. But then she gets off the phone. So this is what her parents are relaying to me, that she's having this horrible chest pain, right? So I tell them I've listened to her heart. I've taken her vitals. I've informed the provider, like, there's nothing that seems concerning to me as a nurse whatsoever. And I tell him, I'm talking to the dad on the phone. I'm like, I'm watching your daughter out there have a calm conversation. I was watching her through this window, this big old window that looked into our day hall. It's like, I'm watching her talk with staff right now. She seems completely fine. She's not grabbing her chest. She's not complaining of chest pain, nothing. And so then I'd go out there and I would like double check on the daughter, on the patient, right? She's completely fine, asymptomatic. The only thing she had was like maybe a little bit of nausea, maybe a little like tingling sensation in her throat when she had the lozenge in there, but more or less like most of her symptoms have gone away. So I check on her daughter's fine. Then the daughter goes and talks on the phone with the parents. And then immediately after she's done with that conversation, she comes back to me complaining of all these symptoms. So we're doing a ton of this back and forth. Like, I'm checking out, making sure their daughter's okay. She's completely fine, you guys. Like, literally nothing is wrong with this daughter. But every time she talks with her parents on the phone, she then becomes symptomatic. The worst time, she gets off the phone with her parents, then she gets out. She literally starts like leaning against the wall and she's just like, Nick, I don't feel good, Nick. She's probably like late 20s or something. And this is all to me, I'm like, I'm watching acting at its worst. Like, that's what I'm thinking in my head. Like this, I was like, her acting is horrible. Like none of these symptoms are real. This is all made up. I think that her parents are coaching her on the phone. So this is what I tell her parents. I'm like, look, I say, Bob, let's just call our parents Bob. I'm like, Bob, let me tell you what I'm observing here, right? And I'm trying to be as objective as possible. And I'm thinking that while we're speaking on the phone, I'm probably thinking that like Bob is recording our whole conversation. I'm like, whatever, fine, record. I'm like, Bob, this is what I'm noticing. I'm checking out your daughter. Her vitals are completely fine. She's got slightly elevated blood pressure. Every time I take her blood pressure, though, it's fine. I was like, blood pressure is not a static number. Sometimes it's going to go up. Sometimes it's going to go down. The more anxious your daughter feels, and it was like, the more anxious your daughter feels, the higher the blood pressure gets. The more we think that this is something, the higher her blood pressure is going to get. And that's probably because of anxiety. But the reality is, I'm watching your daughter as we're talking right now on the phone. I'm watching her speak with staff. She is completely fine. Then what I'm noticing is that she speaks with either you or your wife on the phone. And then all of a sudden she starts complaining of these symptoms. So I'm trying, like, I'm not going to suggest, I'm not going to say over the phone, like, hey, you guys are coaching your daughter to become symptomatic. Because I don't know that for like absolute, like I don't know that with certainty, right? Like I'm not eavesdropping on their phone call. But what I can say, and this was like the subtext that I hope that Bob was kind of like understanding, is like, hey, I see kind of what's going on here. Like that's what I wanted him to understand. But so what I'm telling him is like every time she gets off the phone with either you or your wife, she starts to complain of symptoms. Like I'm just throwing that out there to see kind of what's happening. And I can't remember what his response was to that. I mean, this probably happened 4 or 5 times where she'd get off the phone and then she would become symptomatic, right? So the worst part of her symptoms was like, this was probably the 4th or 5th time, I kid you not, when she got off the phone with her parents. Then she comes out of the room and like starts clasping her chest, and then she's like leaning against the wall and she's totally changing her tone, the way she's speaking. She's like, Nick, I'm just not feeling well. Like totally. And to me, I'm like, this is just horrible acting, right? But I also feel like as a nurse, you have to treat everything seriously, right? Because that one time when you don't, that's the time it's going to nip you in the butt. And I tell them, I'm like, look, if you want me to call you an ambulance, I cannot deny you that kind of medical care. If you want to be sent to our local hospital, I will send you. And so she kind of balks, right? She's signing, well, I don't think so. I don't think it's that bad. And I'm talking to her parents. I'm like, look, I'm offering your daughter the chance to go to the hospital. I will call the ambulance right now and she will go. And your daughter's refusing. And the parents wanted her to go to the hospital, right? But like, it's not the parents' decision. It's their daughter's decision. And so every time I'd bring up the hospital, then the daughter would kind of back like, no, I think it seems like it's kind of going away. I don't really feel like I'm having chest pain anymore, yada, yada, yada. Well, finally it gets to the point, and I'm talking to the provider. Eventually the provider talks with the dad. She tells him like pretty much the same thing that I'm telling him. And it kind of, after the dad talks with the provider, it kind of like calms his fears down a little bit. But I get to the point where I'm just like, you know what, screw this shit. I get to the point where I'm over it. Like I'm done. Like I have a unit to run. I have other patients to worry about. And this is like totally blown out of proportion. So I'm like, you know what? We're sending you to the hospital. I'm calling the ambulance. They're going to come and pick you up. They come out there. They run an EKG. Everything's fine. Her vitals are fine. Yada, yada. But I'm like, you know what? You still need to go because I can tell this is causing you a lot of anxiety. So I think the best thing is just to have you go to the hospital. Goes to the hospital. Now, guess what happens when she's at the hospital? You guys are not going to believe this. Nothing happens. Like nothing happens. Of course, it's a nicotine gum. Nothing happens. Her vitals are fine. Everything's are fine. And so here's the crazy backstory of this. Apparently, when she was at another hospital in another state, the psychiatrist at that state accused the parents, and I think brought him to court or something, for Munchausen syndrome, which is like when you kind of make your kid sick so that you can have more attention yourself. So you maybe pretend that your kid has all these symptoms when they don't really, and you get them into the hospital, and that's somehow a way to draw attention to yourself. Like I'm not a Munchausen expert by any means. That's just the basics that I know of Munchausen syndrome. And it totally, like after our psychologist told me that, I was like, well, that totally makes sense, because that's exactly what I felt like was going on here. It's like the parents were just blowing this out of proportion. And so the main takeaway for me as a nurse is like, you know, I was doing a courtesy. Like I was talking to this family. I didn't have to talk to them. And then I thought about, like, when I got home that day, I remember thinking to myself, I was like, God, why on earth did I talk to them for so long? Like that was so stupid. I should have just like ended the conversation. As soon as I knew that it wasn't about their daughter's health and that they legitimately did not have a concern for their daughter's health, I should have just ended the conversation right then and there and just be like, you know what, I'm done with this conversation. I'm going back to work, and boom, like that was it. So that was like the biggest takeaway for me. But the frustrating part is that later they filed some sort of complaint with like probably the Office of Behavioral Health or something like that. And it became this like huge thing. And I think what's really frustrating for me was just, one, the experience altogether. And then two, my company, they didn't give me a written reprimand, but it was kind of like a verbal warning. And I'm like, what am I receiving a verbal warning for? The medication I gave was an active medication. Like if anything, the whole thing was a miscommunication. Especially I think just given the whole circumstance where you had that other patient come up and ask for a nicotine lozenge. And oh my God, I just remembered, this is the craziest part of the story that I totally spaced out. I don't have any rubric, you guys. So this is just like off the top of my head. It was like a year ago. And so like probably some of these details are all mixed and mashed in an ugly way. But here's the crazy part. So she was the only female patient on her unit. We had a pretty low census. I think our census was maybe like 6 that day. She was the only female patient. I think we maybe had actually one other female patient, but she was the only female patient that day to receive a nicotine lozenge. The following day, when our custodian is cleaning the female bathroom, He tells me he finds something in the bathroom. Guess what he finds? He finds the nicotine lozenge. It was spit out in the shower. So she didn't even swallow it. She had spit it out in the shower. Between her and the family, like everybody was super gamey, like just extraordinarily gamey. And like, in retrospect, I would say that a lot of people would probably diagnose her as borderline personality disorder, and her family probably has some sort of borderline history or something like that. Like the parents were super, super gamey. So that's what's really frustrating about working in psych is you'll get patients who malinger and they fake things over and over and over again. And what I try to do is I just document a history of it. And then you get to a point where it's just like, you know, if I keep giving attention to this, you sort of feel like you're feeding into it, and then you're just neglecting other patients because you're so focused on these fake symptoms that the patient has. It's like so, I don't know, and I don't really know how to describe it. I can just say as a nurse, it's like ridiculously frustrating. And every nurse that I've worked with, it's like all nurses will agree that when you have to work with that kind of patient or that kind of family, it's like, oh my God, dude, it just makes me want to tear the hair out that I don't have. So yeah, so I get this verbal warning from my boss, and I'm kind of like, well, okay, it won't happen again. And our plan is then to just kind of screen people more for nicotine use when they come in. And if they're not a nicotine user, we're just going to discontinue that PRN, because what we would do is just like every patient that walked in, we just had that as a PRN. Not that we would be like, hey, do you want some nicotine gum? But if they came up and they asked for nicotine gum, I'm not going to be like, well, are you a nicotine user? I just would give it to them. It's not a big deal. Just like I would be like, well, I see that you're requesting Tylenol and it's on your PRN sheet, but are you a Tylenol user? Like, it's just like, it's not a big deal. I don't think it's a big deal. Maybe I'm missing something here, and maybe that's the part of me that just doesn't see it. So anyhow, it was kind of bizarre because I got this sort of verbal reprimand and I had to sign this thing. I'm like, you know, I'll sign, then I'm acknowledging that we had this conversation, but I don't feel like I'm really at fault. It was a valid medication. If anything, the provider, the one who wrote the order for the medication, like that is their order. It's not my order. I don't write orders. I'm a nurse, not a nurse practitioner. So that was kind of frustrating. And I feel like my boss kind of understood that. Like he wasn't really placing a blame on me, but it was more like they felt like as a company, they had to do something that made it look like they were addressing the situation, which was a conversation with me, so that if OBH, the Office of Behavioral Health, ever came down and like investigate, oh yeah, there was this like, I don't know. It's just like that part kind of annoyed me because I'm like, well, it's not my fault. Like, why are we having this conversation? I was like, did you guys tell OBH this? Like, I would like to sit down with OBH and we'll have this conversation. Like, I would love to see how OBH would have handled this situation. So that's pretty much the story in a nutshell. And I'm making this video because I'm going to have another video coming out that's kind of crazy, that sort of uses this story as a little bit of a backdrop, but I'm coming out with another video soon about why I no longer work for this company and all of that. So this story here serves as a little bit of a precursor to why I'm not working for this company anymore, but that video will be out shortly. And I feel like there's something that I'm forgetting about this story, but I can even feel myself like right now, I feel agitated as I'm sort of reliving this experience, telling you about it. And I kind of wish that I would have made this. I thought about making this video like a few weeks after the story when the memory was very fresh in my mind, but something, I don't know, something about it just didn't sit right. And I think I was like a little nervous about the whole OBH thing, but like in retrospect, like I don't feel like morally that there's anything that I did wrong whatsoever. Maybe I was a little hesitant because there was this kind of like, I heard about there was this kind of investigation into our facility and stuff. So I was like, well, maybe I'll just hold off till that's all said and done. And then apparently OBH gave our facility some sort of corrective action plan for all this. And it just seems like, I'm like, you guys, for nicotine gum? I was like, are we being serious here for nicotine? Like, I don't know. And then I just thought to myself, I was like, you know, you realize the medication that your daughter takes. I think she was taking maybe like an antidepressant and an antipsychotic. Like, I just wanted to be like, you know, you realize those medications, like if you want to talk about harm, like those medications, let's talk about those medications, because a little bit of nicotine ain't gonna kill you. You know, we all get secondary exposure in the environment to nicotine, smoke, and all that. I don't know. All right, so I was about to stop this video, and this is what I realized. In that situation, as a nurse, and there's other nurses that can, I'm sure, relate to this, like sometimes you're gonna get so frustrated, you just wanna jump out of the conduct of how you normally behave as a nurse and just be like, this is how I want to. I was like, are you guys fucking serious? Like, we want to blow all this bullshit out of proportion for 2 milligrams of nicotine gum. Like, we want to contact OBH. We want to spend all this time and money. Like, and that's what I remember telling the parents on the phone. I was like, look, you guys, I want to remind us that we're all on the phone right now because we're all concerned about your daughter. Like, we share that mutual interest. And it didn't even freaking matter. Like, no matter how many times I tried to bring it back to their daughter and her health, it's like they were trying to blow it up into something that it wasn't. And that, oh God, I was so and between like that, OBH, and then my company kind of giving me that verbal I just want to be like, all right, you know what? Fuck you guys. I'm done. Like, go find yourself your own fucking nurse. Like, that's the way I wanted to be. And I think for me, like, repressing that is what's so hard, because I'm someone who doesn't like to repress. Like, I'm pretty open and honest about shit, and I just like to be myself. And that, I felt like I had to shut myself up before I said something really stupid that I would just be like, I don't know. Anyhow, the whole thing was fucking blown out of proportion, man. Like, that is the kind of shit I'm like, really? Like, that's healthcare. Like, that's the kind of shit that really affects healthcare. Like, it's because of stuff like that then you get like all these tighter constraints around everything. And it becomes so obnoxious. Like, you don't feel like you can have genuine human interaction anymore, because it's like you've got to worry about all these little nuts and bolts of legality, and it's just I don't know, bro. It's freaking crazy. That's what it is, and that's the world we live in. And yeah, I hate it. Pretty much hate it. Pretty much hate that world, and I don't feel like I fit in that world whatsoever. Like, that is not me. Like, I'm a very free. Like, I feel like I feel like I'm a genuinely good person, but it's difficult for me to fit in that world. And I'm very like free spirited and just kind of like do whatever you want, but within reason. And I always feel like I'm considering my patient's best interest at heart. Right. But, man, it's so incredibly frustrating. There are nurses out there who don't give 2 fucks about their patients. Like, literally, I promise you, there are nurses out there, because I've worked with them. They do not care about people, but they're nurses. I know it doesn't make sense, but they will forever have their job because they never potentially violate any sort of policy and procedure. Like, and I'll give you a silly example. What I mean by that, because that might seem crazy to some people, like, oh, and it might seem like I'm violating policies and procedures, which I have. Oh my God, I have. Let me tell you about a policy and procedure. When I worked at the state hospital, I kid you not, and maybe I'll pull it up in their handbook just so you guys can see. I don't know if it's changed since then. This was like a few years ago, but they had this policy, because I remember reading through it and I was so flabbergasted when I read this. It was like something like, you cannot share any personal information with a patient. I'm like, you got to be shitting me. Like, if a patient asks me how my fucking day was, I can't be like, hey, my day was good. Or like, hey, what I do on the weekend? I went out and I shot fucking hoops, man. That's what I did. I went out and shot some goddamn hoops. Are you telling me that if I tell a patient, like, I kid you not, right? Like, that is that is the policy. And I remember when I worked at the state hospital, I only knew of one nurse. And actually, this is why I went back and I read the policy and procedure, because I remember him saying that. And I just remember thinking to myself, I was like, what? Are you serious? I was like, that can't be a thing. We were on an admission unit, and this patient had asked this guy a personal question, maybe something along the line, like a benign personal question, like, how was your weekend, or what'd you do on the weekend? And this nurse, this guy was a chill guy. He said, you know what? I'd love to tell you, but unfortunately, per our policies and procedures, I'm not allowed to share personal information with patients. And I'm like, you got to be shitting me. Is that really a policy and procedure? And I went back, and sure enough, it was. I was like, what? I was like, what do you guys? And I get it. Like, there are certain circumstances when you wouldn't want to share that kind of information. You don't know what the patient's going to do with that information, right? You have no clue, right? But I feel like that's the risk. Like, as a person, as my own person, that's the risk that I want to be responsible for, and that I want to take as my own nurse. Like, if I want to share with them what I did on the weekend, and maybe they want to get out of the hospital and then go stalk me at a place that I went and shot hoops, like, I feel like that is the responsibility of me as a nurse. But whatever, like, it's a whole legality thing. But anyhow, but it's shit like this where I'm like, bro, I don't know if I'm made for this. Like, it makes me question whether or not I'm made for this world, because I feel like that is the direction we're going in. Like, this very PC, ultra sensitive, ultra legalistic world where we're just like these mindless robots, and we've just got to be confined to what policy and procedure tells us how we're going to interact in our jobs and in our lives and all of that. It's ridiculous. Like, it's the point where even publishing a video like this, I feel like a little insecure and unsure about posting something like this. Like, that is, I don't know. It's bizarre, bro. All right, I'm done, you guys. I have I have no idea what this video is or what this video has become. I want to let everybody know that I'm kind of using this as my therapy. So you are like my virtual therapist right now. So I want to thank you for listening to my horrible and poorly told story. All right. That's pretty much me in a nutshell though. Like if I could just get along, if I could just like be a robot, I would be so much happier. Like that is my kryptonite. And I've even talked to my life coach about this. Like he has suggested that if I could just go with the flow with shit, I would be much happier. And that's probably true. Like it's probably true. And it's this weird internal battle that I have with myself, like versus like who I want to be and like my authentic self and just being able to express myself as a free person versus like the confines of culture and life and society and jobs and all of that. Yeah. You guys, what has this video become? If you've made it this far, like kudos, bro. We probably could be best friends. Like we could sit and chill and chat and stuff and we would have a good conversation. But right now I'm looking at a camera, but it feels like I'm looking at you, even though it's just a camera. It's like this singular eye that's staring at me right now, but it should be you. It should be you that I'm talking to. Like we should be sitting here having some tea or like some coffee or something like that and having a conversation. But we're not, you guys, we're not. But we could be, but we're not. But we could be. Oh God, you guys, I'm like just I have so much to share with you recently. Like the last 3 months have been hard for me, like spiritually hard in a weird, very weird way. We really need to stop this video, my friend. We do. Like, are videos supposed to get better? That's another thing. Like, are my videos, is the quality of my videos are they supposed to like improve over time? Because this video right here isn't interesting. All right, let's stop. I just want to let everybody know this is by far the worst video I have ever made for my YouTube channel. So if you happen to make it to the end of this video, which you probably won't, because if it's the worst video, you probably have already left this video. But if you happen to get to the end of this video, then you'll be like, okay, you can agree with me. This is like probably the worst video that I've ever made, but whatever, I'm making it. And I told myself, I don't care anymore. I'm just putting shit out there. So here we go.